they can't really offer much like they would want to offer. So the 2 days is basically because of the logistics component. But if God allows, as we continue growing, maybe next year, you never know, you could even get to a week. But for now, what is affordable is the 2 days.
Okay. Now, let me go back to Doctor. What services specifically are going to be given in this camp?
Yes. Now, apart from the other services I talked about of creating awareness, making sure people are taken through exercise, they are fit, there will be the usual services like routine immunization. Children should be brought and they benefit from that immunization, but also we will do the COVID-19. COVID-19 became part of us, and so it's important that we immunize people against COVID-19, but also give the booster doses. Hepatitis B will be one of the other things. Apart from those, there will be screening of other diseases. Again, like I mentioned, TB is one of them. TB, these days we use artificial intelligence. We don't stop on a microscope, or we do not use the gene expert alone. But we use the X-ray to screen, and it is able to tell us a little more. We will do HIV screening. We will do cancer screening. Cancer of the cervix for women, they should come and we screen them, but also screen for diabetes. We will do general body checkup. Anyone who is not feeling well, just come to the camp. We will be able to do that. Mental health is a big thing, and we will be counseling. Not only mad people are the ones who need mental health care, but also people who are normal people, and for example, you're stressed or you don't understand things basically that are going on with you or with your family. You need to come. Eyes, I've talked about them. We will screen, but also provide glasses, dental care. There will be service providers who will be providing dental care, family planning, and orthopedics. One interesting thing is about orthopedics, that we will be looking at people who have been amputated, and we will provide devices. Those devices are like I can call them, if you have no leg, then they can provide you something which is artificial that you can move on. If your hand is gone, they can provide you something that you can
use. Also being provided.
Yeah, and we know
no cost as well.
No cost, at no cost really. And we know that much as we are all right today, anything can happen to us. So they will also create awareness. Safe male circumcision will also be there. We have trained people from different hospitals. They will be doing that. We encourage young people to come and donate blood. Yes.
That is a very big aspect of donating blood. But now you talked of some tests or screening that will be done. In case someone is found to be with TB, what happens next?
Yes, in case someone is found to have TB, TB is one of the diseases that these days is curable. They are started on medication, and also they make sure that they continue with medication. And also they are screened for HIV to make sure they don't have HIV. And but they are treated well and started on treatment there and then. There will be instances where some people, for example, if we diagnose cancers, we will not start people on medications. We need to refer them to Mulago. And so we will be referring difficult cases to Mulago. You know, some people find it difficult sometimes to access those referral services, but we will be at their service in the camp.
And an instance of HIV as well, what is, they also call it first aid? Okay, what first help do you give to these people?
Treat and test is the thing. I mean, screen, test and treat is the thing. Yeah, we will test and also we'll start them on treatment. In Kisaasi, yes, counseling will be provided at the same facility. And in Kisaasi, we already have about 260 patients who are on HIV medicines. So really, when somebody is tested positive, they are health workers who will be counseling and will be provided the necessary treatment.
Okay. Maybe if I can go back to Benjamin, speaking about the camp specifically, we have the dates of 25th and 26th.
Yep.
Yes, on what specific time do are people expected to be there?
So we are going to be ready to receive the beneficiaries as early as 8 or on a daily, that is starting tomorrow, and then we shall be closing at 5 p.m. So it's 8 to 5.
Okay. And who are the target audience? Every person or specifically Christians or Kisaasi Church of Uganda?
Like I said in my introductory remarks, it is open to everybody. You could be a Muslim, you could be a Catholic, you could be an SDA, you could be an Orthodox. The camp is open to everybody. What we are trying to do is, apart from the ministry that targets the soul, we also want to look at the well-being of the people we live with, because these are brothers, they are sisters. So it's open to everybody.
All right.
As long as you can make it there, because it won't be a virtual service.
All right. Very interesting. And maybe to talk of the benefits, let me give this question as well to you. What benefits do you intend to get out of this camp?
Now, from the camp, as the organizers or as Kisaasi Parish 1, we are expanding our reach in terms of ministry. When I serve somebody from the SDA church, when I serve someone from Chibuli or Old Kampala, I feel happy. I feel excited because I'm giving back to the community. That is one. Two, in church, like you may know, people give. You give tithe, you give offertory, you give thanksgiving, and sometimes you find that probably there is no way where a church is going to give back to you. So we are looking at these services as part of the avenues that we use to get back to the Christians and make them better, because we also need a healthy congregation.
Yes.
Without a healthy congregation, the church will not grow.
And awareness, raising awareness about health and sort of.
Of course, awareness is a given, because we're going to be talking about it. Like we've got this platform for Family TV, which we know has a wider coverage. I know people are watching and they're getting the messages that we are sharing out. So in terms of awareness, we think it is something that we are going to achieve.
Wow, that's wonderful. We're going in for a very short break. Please interest yourself in paying keen attention, and also please head to, instead of marching to Parliament, you can decide to march to Kisaasi. That will be tomorrow, and get yourself tested in different aspects, and of course get to know of your health status in that regard. Well, very short break and return with this conversation.
Issues at hand, powered by
Protea Hotel by Marriott Metebi. Comfort and luxury at its best.
This is Church of Uganda Family TV, enriching lives. This is Church of Uganda Family TV, enriching lives. Issues at hand, powered by
Protea Hotel by Marriott Entebbe. Comfort and luxury at its best.
Yes, comfort and luxury at its best. That is Protea Hotel by Marriott in Entebbe. That is gearing us on this kind of discussion. I always encourage you to contact them, more so when it is coming to a weekend. Or if you have any function, they have very, very ample space for any event there. So please do contact them and find yourself at Protea Hotel by Marriott in Entebbe. We are discussing the health camp that is starting tomorrow at Kisaasi Parish Church of Uganda, and of course I have partnered people here who are key at in the organization of this health camp. It is now this is the third year in a row, and yes, it has been impacting the community there. So my question now to Doctor, since it has been there for now, this is going to the third. This is the third time.
Yeah.
Yes. So is there a provision of follow-up on the people you test, on the people you work on, people of beneficiaries of this health camp for the previous years? Have you provided a follow-up to check on how they are doing also too?
One of the things we do in the health camp is to take records. We take records in the camp, and after taking these records, we make sure we provide the first service to the people who need it, and those like who need chronic treatment, for example for HIV or for TB, they are handled at the facility. Like I said, like in the previous camp, we got people who needed further treatment, who needed further checkup for cancer. They were referred to Mulago. We still need to follow up and make sure that these referrals, we really know what happens to them, the ones which go outside the health facility. But the health facility is a point of really of follow-up, because whoever is diagnosed at the health center 3, we will make sure that we treat them further and follow up until they are really cured. Yeah.
Now, Mr. Benjamin, what impact do you see this health camp bring up majorly to the community?
Now, in terms of impact, like I said, kind of, we start with a closed group. We say Kisaasi Parish, so meaning the very first point of contact are the parishioners. And referring to the records that Dr. Abel has just mentioned, if you're to look at the addresses and whatever, you'll find that we have more of Kisaasi coverage than the rest of the other areas. But we've had people come speak out, and someone says, it is in the other camp that I was able to test for diabetes. I didn't know that I had a stain of, or hypertension. Someone didn't know, but because they came to the camp, they were able to identify that.
Okay. And how do you see the role? How does the church involvement in this impact on the mission and the values of the church?
Of course, like I said earlier, we, apart from focusing on the soul, food for the soul, when we do this, then we know we are impacting on individuals, because we are providing an extra service that probably someone will not find in the service, in the church. Though again in Kisaasi, we are doing it differently. We get different people, they come, instead of the usual preaching for the soul, we have someone say something about HIV, or say something about TB, or say something about the NCDs. Yeah.
Very interesting. And now, Doctor, knowing that this is not the first time, have you encountered any challenges during maybe the organization or the execution of these past health camps, and how do you see to maybe better the services and so on?
Yeah, that is a very good question, because there's nothing you do without challenges. Yes, but we thrive in challenges, because challenges is where work is. So the first challenge is that the work we do is voluntary work, and therefore we do it as volunteers. The organizers are volunteers. These are people from the church congregation, so they give their time in order to organize the service. The other is that the service providers are also volunteers. You find that this year, some service providers will provide the service, and next year they will say, no, we don't have a budget for that, and so they will not come. So you'll find that the consistency, since it's a voluntary service, sometimes can drop. And so we ensure so much to make sure that there is consistency by asking right away, would you like to be part of us during the camp? But we have kept all these service providers that we began with and just added. So that is a challenge that we have anticipated and we have been able to deal with. The next is, of course, funding. Funding is not available, and you have to look high and low for funding. You contact banks, you contact service providers, but also the individuals, and they usually give in funds. And the beauty about funding, that sometimes when you get good funding, you will be able to offer a range of services. If you are not able to get that kind of service funding, then you will need to cut back on some of the services that you offer. But you will make sure that the package is really comprehensive. So we are able to deal with those issues of funding. The challenges are many, but I'll mention maybe a few. The other is the data capture. In the beginning, capturing the data, knowing how many people we have provided the service, which service was difficult. It was paper, manual, and so on. This time we have taken it to another level. We are capturing data electronically, and we are making sure that things will be comprehensive. Making sure we use the smartphone, people capture data there and then, and in real time we are able to get it and do analysis. The previous times we would keep it on paper, and then we have to collect that paper, collate it, compile, analyze, and get it. With the coming, or with the utilization of the computer, because it has been around for some time, that challenge will be sorted out. Okay. Yeah.
Well, that's interesting.
Yes.
And now, Benjamin, if you could also highlight for us how you've been able to measure success, and basically for the past two camps that you held, and if you can shed a light on where you see it next, where you see the camp next.
So in terms of success, what I would look at first is the coverage in terms of numbers. In year one where we started, the numbers were smaller. So year by year they kept on growing. And we are hopeful that what is going to happen tomorrow and Friday, the numbers are going to be bigger. So of course we do that based on the records that Dr. Abel has mentioned, has talked about. That is our basis of knowing the coverage. So we do counts. Last camp, so many people came. This year, so many have come, and we're waiting to see what happens tomorrow. So we look at the numbers.
Okay. And that's quite interesting. And looking at the services offered, and you talked about funding and all that. Is it even the medical people who are going to be there? Is it also voluntary?
Yeah, I will say it is voluntary from my perspective, but I know that most of the organizations we work with, they come with health workers, and those 2 days they will facilitate their health workers. But as a parish, we will not facilitate those workers. So depending on where you're sitting, you can say it's free from where I'm sitting, but where the funders are sitting is not really free. They are offering unorganized service, making sure that the service providers are comfortable. We also, as a parish, make sure that the service providers are comfortable. We will have breakfast, we will have lunch with them, just to make sure that things go on and they go on.
All at free cost?
Yes, free to the providers, but at a cost to the one giving. Yeah.
Okay.
Yes.
That's interesting. So if I'm a beneficiary, am I also entitled to lunch and breakfast?
We have not reached at that stage, and we hope in the next camp we will reach that stage. We provide medical health services free of charge. We have not reached the extent of providing free services. Last camp, We provided water. This camp, we will see what we will do. But food, not yet. We hope in coming camps we will be able to provide free food to the patient. Yeah.
And but what is the turn up for those coming for blood donation? How has the turn up been?
I think it has been progressive. In the first camp we had about 12 people providing. In the second camp we doubled that to about 24. And this time around we want the target to be 50. We have been working with Red Cross, and Red Cross has promised that we'll be mobilizing the volunteers, but we also have volunteers at the church, our youth, and we hope that they will be providing blood. Yeah.
And what measures have you used to make sure that people embrace or get to know that there's a health camp, maybe with the exception of Church of Uganda Family TV?
So with the exception of Family TV, we've tried to utilize the local means. We've done the community use of the megaphones. We've done the cross banners in the busy centers. We've also done boards close to the church where people may pass, and to make sure that the banners are visible, but also the church announcements within the parish, and also the neighbors, the neighboring churches. So that's a publicity we have, and we've also had some radio talk shows. We've secured some airtime, and we had guests to speak about the camp as well.
Okay. So we are hoping for good turnout.
We are very hopeful, very hopeful.
Okay. So what message do you send out to the people about this camp?
So about the camp, I would just want to thank the stakeholders, those that I mentioned earlier. In the interest of time, I didn't mention everybody, but there are people who have stood with us, Kulambiri Rotary Club, Kula. There are so many. The church organizations or groups, Fathers Union, Mothers Union, Christians Men's Fellowship, Christian Women's Fellowship, the youth. All of them have supported this cause. So I want to thank the partners, including people who have given us medicines, Frieka Pharmacy, Joint Medical Stores, the Kampala paramedics, the micro labs. These have supported us with the logistics to support the camp. So mine is a thank you message. And above all, the parish leadership, led by Reverend Emmanuel Lutaya. Of course, he embraced this idea that came through the health coordinator, Dr. Abel here, and he has supported us. He has supported us. So he's with us.
Interesting, and actually that's what I want to ask before I go back to Doctor. What kind of support have you gotten from the parish?
So from the parish, the parish are individuals. So like Dr. Abel mentioned, part of our logistics resources are the people, the parishioners. So the parishioners have given us money, to do most of the things, hire tents, get the PA, and so many things. So they have given us money.
All right, that's interesting.
Yep.
So Doctor, have you received any feedback from people you have worked on previously?
We have got some feedback, like Omulangira Benjamin mentioned. Yes, we have got some feedback from the people who came. They said, one of them, if I can recall, said, if it were not for the camp, I would not have checked for this high blood pressure. It is out of this camp that this blood pressure was detected. And then the other feedback we have received is about the supermarket effect of the camp. That when you come to the camp, you are able to get any service. Unlike when you go to the hospital, you go to one clinic. But here in the camp, you'll go and you do body checkup, you'll go for exercise, you'll go for dental checkup, you'll go for eyesight. So there are many things people can access, many services people access within that. And they said you should not stop. That message of you should not stop has been re-echoed by the parish. They said we need to institutionalize this health camp because we have seen what it does. People need the service and they get a free service. Yeah.
And now back to Omulangira, Benjamin. Talking about the health camp, should we say that this is the new way of reaching out to the community or preaching to the community, sending the gospel? Because one thing we know, we are all certain of, traditionally the church was for the gospel and period, that is it. Is this the new way of reaching out to the masses in the community?
It is a yes or no, a yes and no. I don't want to entirely say it's a new way, because we are not the pioneers of health camps in the church or run by the church or managed by the church. But we are thinking once strengthened, it can also create impact. The community looks at the church, apart from looking at the building, what else do I benefit from the church? Or apart from waiting for voting day, because I know most of the churches are voting polling centers, apart from waiting for that day, if I'm a Muslim or any other denomination that is not Church of Uganda, what takes me to that place to benefit? So we are thinking, like you said, it's a no and yes. But once strengthened and the scope is widened, we think it's going to create a greater impact in terms of our ministry into the community.
Wow. So, Doctor, what future plans are we anticipating to have for this health camp? I understand you're the health coordinator when it comes to this aspect. What are the future plans you're holding for such initiatives?
I think the future plan is to make it better and to provide a service, because we have to listen to the people. The people have said this is a good service and we want it. And when we say we have the service, the people come in large numbers. So for us, the future is to make it better and better. One, we have, as I highlighted earlier on, one of the challenges is funding, getting it. I think we need to be very organized in future in the way we get funding. We need to reach out to organizations, corporate organizations, through their corporate social responsibility in order for us to get additional funding. Yeah. And what else? And the service itself, to make sure that we have a good multitude of services. I think we usually run usually kind of an evaluation for service providers, but also for the people who come to the camp, and that helps us to map out what is the future. So even in this camp again, we will do the same, and the future will be determined by what the people who come to the camp, but also what the service providers say.
Okay. Yeah. It's really, really interesting. And in case you're just joining us, we are having a health camp starting tomorrow. That is at Kisaasi Parish Church of Uganda. If you know, it is in Kisaasi there. So please, you can reach out. But in case you're joining us, I'm going to request Omulangira to give us an overview of this health camp as we head on, because I see time has started squeezing us in.
So in terms of the overview, the dates are clear, and we are speaking about a health camp that is going to be cover a wide scope of medical services. I mean, anything you think about health. Actually, when Dr. Abel got to the point of the amputees, I mean, that is something that is not very common when you talk about camps. People are used to HIV counseling and testing and blood donation, but this is a scope. It's a comprehensive camp. It's going to do anything you can think about health. What we want to be able to handle on site, again through the referral system, people will be referred to the appropriate health centers. Dr. Abel mentioned Mulago, but we also know there are others that can provide similar services using the referral mechanism. Okay. So that's it. What I can mention about the
and
camp.
It is going to be at the church?
It's going to be the St. Peter's Gardens is located just close to St. Peter's Church, within the same compound. We have some huge space that is going to be set up with tents for the service providers with the various services that we are talking about. So it's going to be a one-stop. The moment you get to St. Peter's, that will be it. Maybe a quick direction to St. Peter's for those who might not know. When you take the Bukoto route, continue as if you're approaching Bahai Temple. There's a roundabout. You just turn on your right. The church is just close there. If you're coming from Tinda, from Kisaasi Trading Center, the traffic lights, you just continue up. Again, you'll find the church a few meters away from the traffic lights.
Wow, that's interesting. And are there numbers for inquiries and sort of?
So the numbers for inquiry, one of the coordinators is here, Dr. Abel Nkolo, and I'll read the number for Dr. Abel Nkolo. It's 772-613-568. 0772-613-568. And then, of course, our parish priest, or the vicar, Reverend Emmanuel Lutaya, on 0782-190-560. So in case you call those numbers, you have everything that is related to the camp.
Wow. Thank you so much, Omulangira Benjamin, for that. Now, as we come to an end of this discussion, I would request, Doctor, you give us your last remarks in regards to what you anticipate or what people should expect out of this health camp, and maybe calling upon them to come and attend.
Yes, thank you so much, Ivan. I would like to thank Family TV for hosting us here and make sure that the people out there are able to know what we are going to provide in Kisaasi Health Camp. The services have been organized. It has taken us 8 meetings to organize the service. We know the service providers that are coming. They are good and they are well prepared. We have got the medicines. We have worked with different entities. Frieka, I think, is one of them that has given us medicines. JMS has given us medicines, and we are getting medicines also from Naguru Referral Hospital. And then our Kisaasi Health Center has also provided medicines. So in terms of service provision, we are prepared. Medicines, we are prepared. In terms of making sure the service is well coordinated, we have done that. And so everyone who comes will be given a number, they will register, and they will receive the service, and we will record that service. So come in big numbers at the health camp. We will be there to offer you the service.
Wow, yeah. Very great indeed. Of course, Benjamin as well, with no exception. And by the way, one question, are we also going to have a little prayers there, or it is entirely medical?
The prayers is a given. We start with a prayer on a daily. So that's a given. Led by our clergy, we shall be having opening prayers on a daily basis.
Okay. Please,
and then at closure.
Oh, at closure and daily. Okay.
So in terms of my parting remarks, I just want to thank Family TV for the opportunity, but also thank the province of the Church of Uganda for the thought, because this is an avenue that we use, that we comfortably use as a church to make sure that our message goes wider. And I would say and commit on behalf of the parish that we are going to spread the message and try to get as much business as possible, because we need the TV to run. Lastly, to call upon the people, just like Dr. Abel has mentioned, the camp can only be a success with numbers, but also encourage people to keep time. Time is very key. In the recent past, Dr. Abel did mention, but as you're closing on the last day, you see a bulge of numbers, and then you wonder where people or where they have been. So we are requesting people to make time and come as early as possible. We start tomorrow 8 to 5. Just make sure you fit within those hours.
Oh, wow. Thank you so much. That is Benjamin, who is a Synod Delegate for Kisaasi Church of Uganda Parish, and also Dr. Abel here, who is the Health Coordinator, and specifically for the camp this time round. Well, the camp has been there for 3 years. I mean, this is the 3rd time, so it is not just that they are starting, they are on grounds of experience. So please reach out to them, or that is starting tomorrow and also the following day. Do not come on the last day, just like Benjamin has said, and then you claim that we have not had services. Starting tomorrow, go there the entire day. If you want, you can go back again if you have other issues pressing you there. Well, my name is Majumba, and I want to appreciate you for having joined us here today, and I hope you're going to make use of these free medical services that are being provided. Kisaasi is not so far, I don't know where you could be watching from, but it is within the reach around Kampala. So please, you would want to make your way there. We are powered by Protea Hotel by Marriott Entebbe, and I want to wish you a lovely day.
Issues at hand, powered by
Protea Hotel by Marriott Entebbe. Comfort and luxury at its best.
This is Church of Uganda Family TV, enriching lives.